Hello, this is day 1 after surgery. Man, this surgery is no joke. I'm in a lot of pain, so lots to say. I am in a lot of pain. I'm taking the Percocet, but I'm trying not to take it too much because I don't want to be constipated. But the nurse called today and said that I should take it so I won't be in pain, and then take laxatives. So I took my second dose of laxative. Still haven't had a bowel movement, so this would just be day 1 of not having a bowel movement. But it's still early in the day. It's like 10 a.m. And the pain is 2 places. I can feel the muscle tightening that they did. Feels like you did 1,000,000 sit-ups. Like your muscles are very, very sore. And then I can feel the incision as well. I would say the incision is worse, like somebody cut you. So that's worse. So I just took another Percocet. They gave medicine for nausea. They gave me suppositories that you put in your rectum, and I don't like that. So I've been trying not to take them, but I started feeling a little nauseous today, and you don't want to be throwing up because there's a lot of muscles that you use in your core to vomit, and you don't want to be doing that because it would be hurting, of course. So I took a suppository, and I think the nausea has gone away. I don't know if the nausea is because I haven't brushed my teeth, which I'm going to do here soon. So I have like a weird taste in my mouth. My mouth is dry. So, I just had a small wave of nausea just come something to my eye. So, I'm going to show a few things. I wore this to surgery. It's a dress that's easy to get in and out of. I went with a sports bra on, came home without one. But I've been wearing this ever since. And I also wore a string thong because I wear those a lot for my man. He loves them. And I was concerned about scars, so I wore my string thong, and they used that to mark where the incision would be. But there's a lot to say about the surgery because the doctor did something completely different that I wasn't expecting, that I knew no knowledge of. So I had to research after the surgery, what it was he did, because I have never heard of this procedure. But again, I'm one of those patients that was kind of rare, I guess, in that I had very little body fat or stomach fat. And so there really wasn't a lot of extra skin. My main issue was the muscle separation, and then a little lipo on my flanks. So not a bad issue to have. So I'll talk about the surprise that he did in the procedure. But I'm going to document. I'm using a rolling chair right now. Ooh, push this down. I have my phone on a music stand. Okay. Standing up and sitting down is painful. So when I came out of surgery, I went to the restroom before I left, and the nurse said, okay, you're probably going to be hunched over, so just let yourself be hunched over because you're going to be in pain. But when I stood up, I felt it, and then I stood almost completely straight up. She was like, oh my gosh. And my boyfriend who was there was like, wow, you can stand straight up. I think she thought I was showing off for my boyfriend because when she got me to the bathroom, she said, now, are you sure you're not in pain? You sure you can stand up straight? And I was like, yeah, I mean, it hurts, but Standing up straight wasn't as hard as I thought. So I'm still mostly straight. I'm a little hunched, but I'm mostly straight. It feels better to me to stand up straight because your back hurts when you hunch over down here. So because of that little back pain, my body wants to stand up straight. So this is the dress I wore to surgery. I have one drain, and they said I only needed one because I'm a small person. I just emptied it. I got to 25, which is the first line, finally. I emptied it twice yesterday, and it wasn't even at 25. But overnight, it got to 25. And when the nurse called, I told her, I was trying to let it go longer before I empty it so I can get more. And she said, no, actually, you don't want more. You want less because then we'll take it out sooner. Today is Friday. My surgery was on Thursday. I have an appointment on Tuesday to take this drain out. So that's less than 5 days. So that's pretty good. Oh, I was going to show you a document. I forgot. I have no underwear on, nor do I have a bra. I'm just going to go down this way. Then my girls will be out. If I go up this way, everything here will be out. So just know I have a black, let's see if I can show it. A black, what do you call this, compression garment on. And I have no idea what it looks like. I bought a walker from Amazon, but I didn't take that sucker out of the box because I figured if I need it, I'll tell my boyfriend to put it together for me. But if I don't need it, it's going back to Amazon. And so far, I haven't needed it. I've been just using a chair to help me stand. A little more nausea. I'm actually home alone right now because my boyfriend had to go take care of some things. But I think I'm okay. Now, so let's talk about the surgery. So I get there. I just took that narcotic, so I might get loopy. So I get there, and they do all the preliminary whatever. The first problem I had was taking blood. Not taking blood, but putting the IV in. Even though I'm very vascular, look at that. Look at those veins. I do have a burn here. I'm very vascular. You don't have a bicep vein here. Medical professionals always have a trouble getting blood or getting an IV or whatever in my veins because they say my veins roll. Now, I have had a few that have no problem. They're like, I don't know what everybody's talking about. But most of them, they have problems. So, I told her, just so you know, a lot of medical professionals have trouble getting to my veins because they say they roll. And she said, okay. So she went and got, I told her most people use a butterfly, whatever they call it, because it's smaller. So she went and got something special. Her first attempt was not successful. She said, oh my gosh, you're right. That sucker really just rolled on me. And I thought I had it. And then she said, you know what? Let me try your hand because I have good veins in my hand too. And she said, I'm going to try one more time. And if it is not successful, I'm giving up and I'm going to get somebody else to do it. So she tried it. She said, dang, that didn't work either. And I was like, are you serious? I'm thinking now I'm going to be stuck 3 times or more. And then she sat there a minute and she said, wait a minute. Oh, it's working. And I was like, thank God it's working. So I had it in my hand. But it was very uncomfortable because I couldn't close my hand. It was hard to text. But I she said, well, would you like me to redo it if it hurts? I said, no, leave it. I don't want to be stuck again. So, and doctor came in to mark me, and first thing I wanted to talk about was the top portion of my belly, because I'm having a mini tuck, which is for patients that only have issues below the belly. I don't have much belly fat at all, but my belly protrudes and I look like I'm 2 to 3 months pregnant, which he said was because of my muscle separation. But I felt like I had protrusion above the belly as well as below the belly. So I was concerned about tightening above the belly button, because everything that I watched about the mini tuck was that they only tighten the muscles below the belly button. So I mentioned it to him, and he said, well, I'm actually going to do he called it a floating belly button on you. I'm going to float your belly button. And I was like, okay, that's new. Didn't mention that before. I guess he went and looked at my before pictures and saw that I need something a little bit more than a mini tuck. So I'm thinking that just means he's going to lift my belly button, not release it, and then sew. Because I've seen a doctor do that. But he said he's going to float. I'm going to float your belly button, and that way I can suture your stomach muscles all the way up to the top. He said your belly button will be moved a little lower. And I'm like, okay. I'm thinking it's going to be lower because he's going to just stretch it down. But no. When I got home, I looked it up, and with the floating the belly button means that they actually cut the stalk, release the belly button. So you keep your same belly button, but they pull it down. And it's really good for patients who have an abnormally high belly button anyway. And I look back at my pictures and my videos, and my belly button is high because your belly button should be at your waistline. And my belly button was a little above. So it should be at your hip bone, actually. So, yeah, that was nice, because I see a lot of doctors on YouTube say with a mini tuck, they can't address the top part of your belly. You need a full tuck. So I'm glad that he didn't resort to a full tuck. I really don't need that. I just need my muscles tightened all the way up. So he did that. I get out of surgery. I am so loopy. My boyfriend comes, and the nurse keeps talking to me. I cannot stay awake. And she's like, well, they gave her the minimum amount of narcotic, whatever they call it, they put to sleep. But she's very tiny, so it really knocked her out. I couldn't stay awake. She kept trying to talk to me. I couldn't stay awake. She kept trying to get me to breathe, this little breathing thing you suck in to get my lung capacity. It was so hard for me. My blood oxygen kept going down, and the thing kept beeping, and she kept saying, breathe in deep breaths, breathe in deep breaths. Hard to do. First of all, because I'm tired. I told her if I wasn't so sleepy, I could do it. I need water. So, that situation finally ended. My boyfriend, our relationship is kind of new. I mean, it's not even a year yet. And he's squeamish. So we had agreed that he would be here to help me, but I wouldn't make him deal with the blood. So she proceeds to start showing him how to empty my drain. I was like, no, don't show him. She's like, well, you're not going to be able to do it. And I was like, oh. But he handled it like a champ. Of course, when I got home, I emptied my own damn drain. He helps me up to the bathroom and stuff, but I don't make him empty the drain. So, went to the bathroom. That's when I stood up straight, and she was like, are you sure you're not in any pain when you stand up straight? And I'm like, yeah, it's a little sore, but I felt like I could stand up straight fine. I didn't need to be hunched over like that much. Anywho, so that was the surgery. Saw the doctor the one time when he came in to mark me up, and that was it. But this doctor, I know him and his family and his wife, been to his house. So I kind of have a relationship with him, and he gave me a discount. But he came in just bragging about his relationship with me and my children. Yeah. And even on the consultation, he was just bragging about me and my kids. So it's pretty cool to have a doctor that you know. And I think it's more pressure on him because if he messes up, you know, I know the guy. So hopefully that meant he was going to try harder to make sure he did a good job. So he did lipo on the sides. I asked him how far in the back he can go. He said he'll go like about that much on both sides. I don't know where else he did it. I hope he did it up here too. But I'm just ecstatic that he was able to address the muscle tightening all the way up. My waistline is normally 26 to 27. I've been wanting to get a 24-inch waist for the longest. But if I starve myself, I can only get down to a 26. I've tried. So I'm really hoping I can get a 24-inch waist. Then I'll be proportionate because I'm pretty boxy. My proportions are about 35. And if I can get a 24-inch waist, girl, can't tell me nothing. I did a try on of dresses that I can't wear because of my pooching belly in another video. So you should check that out. I can't wait to be able to wear those dresses. So anyway, I just wanted to get on here and show how I'm doing. It's not even 24 hours. My surgery was at 10 and it's 10 now. So I guess it is 24 hours since my surgery. They want you up and around. I've gone up the steps twice. Proud of myself. Not without pain though. And I've gotten up to use the bathroom here and there, but these narcotics be knocking me out. So I've been sleeping most of the time. So right now I'm going to brush my teeth and try to floss because I didn't do it yesterday. And then I'm going to probably have a muscle milk for protein. I usually drink those every day. And yeah, this is a very painful surgery. This is worse than having a baby. Coming home from the hospital, I had no pain. I wasn't cut. I had vaginal bursts, 3 vaginal bursts. I wasn't cut in the vaginal area. Everything stretched out beautifully. And I got no stretch marks. 0. I don't know how that happened. I attribute it to the fact that I'm a runner, I guess. My mom got stretch marks. My sisters got stretch marks. But I got 0 stretch marks. So, I've never had this much pain. So it is painful. So now I'm going to brush my teeth and then I am going to rest. So this is 24 hours after surgery. Bye.